Hello. I am pleased to see you all here, and also to the people who are watching on Horizon House Television. And for those of you who can't find a seat, there are seats available in the B1 exercise room where we have television down there as well. I'm a new resident here at Horizon House, and I'm very pleased to be a member of the Wellness Committee, and it's offered me an opportunity to use some of my experience within the community to be really feel like I'm a part of this community. Today, the Wellness Committee believes that the topic is going to be very useful and something that you can apply today in your daily lives. Our topic, as you know, is stress and the effective management of stress. And the Wellness Committee chose this topic in particular to further the vision of Horizon House, which, as many of you know, is to enhance the well-being and health of the Horizon House residents. And the Wellness Committee wanted to expand this a bit to talk about the community a little more, which is diverse and, as you know, consists of assisted living, consists of independent living, and all the caretakers who do so much work within those domains. And it also consists of family members who put a lot of work into caring for their loved ones here. And very importantly, the community consists of staff, and the staff at all levels. We are an interdependent community, and the staff is dependent on us, and we are dependent on the staff. And we have, even though this is a diverse community, we have more in common than diversity. One of the things that we have in common is that we all experience stress, and at different levels, and I don't need to tell you about that since you all know about stress. And each of us copes with stress in our individual ways, and usually they're habitual ways, and sometimes they are effective. Sometimes the way we cope is not effective, and sometimes the way we cope creates more stress. The speaker today is an expert in helping us learn to cope more effectively with stress. Dr. Rhodes has worked in this field for a while, helping people learn effective non-pharmacologic ways of coping with stress. And he specializes in the treatment of memory impairment and cognitive impairment. He is one of the founders of the Fry Memory Hub here in Seattle. He's well qualified for this presentation today. He's a neuropsychologist at Harborview Medical Center, and he's also an associate professor at the University of Washington Medical School. So it's my pleasure to introduce Dr. Kristoffer Rhodes.
Thank you so much. How's the volume? Is that okay? Everybody? Nope. I'm seeing mostly heads, yes, saying yes. I'll take the mask off. Oh my gosh, what a relief that is. Whew. Well, first and foremost, thank you for that lovely introduction. It is an absolute pleasure and an honor to be here with you all, and those of you who are in a different room and able to watch this in your rooms or at a later time. That is the era we are in with the hybrid presentations. As I was preparing for this, one thing that I recalled was I came back to Washington in 2002, so 20 years ago, last August, to do the equivalent of our residency and fellowship at the University of Washington School of Medicine. And I was at the VA hospital at that time, working with the Alzheimer's Disease Research Center as part of what I was doing. And they would go out and do community talks about what's normal, what's not in terms of aging. And they said, would you go to this place called Horizon House and do a talk? My very first talk in Seattle was here 20 years ago. Today is my first in-person talk in 2.5 years. So I usually do about 30 to 35 presentations a year, typically either community-based or continuing medical education or conferences. When the pandemic hit in early 2020, those stopped for a few months and then rotated to virtual. So for the last 2.5 years, I have been standing in my office talking to myself without an audience. And it is really nice to be back with real people. So yeah, so really it's a pleasure. I also am approaching this with the understanding that this is a tough topic because there are no easy answers, and I'm not going to pretend to offer you quick fixes or anything that's an overnight kind of success story for dealing with stress, particularly since many of the things that stress us out are not ones that we can take off of our plate. But to talk about ways to manage stress, I think is maybe more appropriate than avoiding it. I also come to you as, thank you to Dr. Hamm's introduction, as somebody who spends time divided between clinical work, research work, teaching work, administrative work. I spend most of my time in our Memory and Brain Wellness Center at Harborview, which is through the University of Washington Department of Neurology. I also maintain a forensic private practice, and I work with all of our professional sports teams doing concussion management and return to play evaluations. I am the parent of a 14-year-old high school student. So stress is not unfamiliar. So there you go. So next slide, please. Oh, and then the other fun fact too is for about 7 years, I was at Virginia Mason Medical Center across the street here, and my office faced Horizon House. So many, many hours looking at this building. So nice to be back inside for a professional reason. So my hopes today are to talk about stress in terms of both the acute and the chronic effects, to talk a little bit more about the impact that stress has on us, both body and mind, because I think those are two related sides of the coin, to talk a little bit about burnout and what happens when we get overstressed and maybe ways to prevent that or come back from it if you're there. To talk about a couple of practices, so concrete things you can do. Maybe you're already doing them. That would be fantastic. To talk about and introduce the topic of mindfulness and meditation and how the two are related or different. This is part one of a two-part series, and the second is around mindfulness more specifically, and particularly the interaction between mindfulness and cognitive function as pertains to things like Alzheimer's disease or mild cognitive impairment, which has been a long-term interest of mine. And then again, really kind of focus on practice. I also am hoping to get through the slide portion of this in about an hour. You are good people and you deserve better than me talking at you for an hour and a half. So I'm hoping we can have a conversation at the end of this. Next slide, please. Oop, I guess we'll move to that one. So many of you know this definition inside and out by either personal or professional experience, but I think of stress not so much as what happens to us, but the story that we tell ourselves and the way we relate to that thing. So events in and of themselves, may not be so positive or negative, but the way they shape our reactions, I think, is a major driver of stress. And I also think of it as a situation where the demands in your environment exceed the resources that you have to effectively handle it in that moment. So, if I don't have good problem-solving strategies, or if I'm not well slept, or if I don't have connections to other external things that could help me deal with something, and a situation arises, that might be very different than if it's oh yeah, this came up, but I totally have what I need to handle it. And I can make those things kind of happen right now. And often it is change that precipitates a stress response. Whether or not that change sticks around and then becomes chronic, different story. But we have emotional reactions to events that are kind of shaped by stress or manifest as stress. We have certainly physiological things that happen in the body when we experience stressors. And then there are environmental things that occur also. I will also share with you that in preparing this talk, I was pretty stressed out. You know, I've been here a bunch of times. I know what audience you are. You're a discerning, bright, insightful, inquisitive audience. So, you know, you can't just show up and kind of wing it. You gotta bring your A game when you come to Horizon House. So, but I also then was realizing, oh, you know, some of that's the story I'm telling myself about what I need to or should do here. Next slide, please. If we think about stressful events, right? So, and again, there's some difference in terms of what these events mean to us, depending on our experience, our resources, the relationships we have. What strikes me about this instrument, this is a long-standing, this is from the 60s, with some modifications over the last few decades, but the ranking of these things tends to hang in there about what are typically the most stressful events for people as they age, as they live. And what you'll notice from this is that these are both positive and negative events. So the most stressful on this scale is death of a spouse. And that is something, as we age, that becomes much more of a reality, right? Divorce, separation, death of a family member, death of a close friend. You know, I work with a number of our senior living communities around Seattle, and the number of losses in those communities, especially over the last couple of years, is astounding. And living with that day in and day out is incredibly stressful. Similarly, positive events like getting married, welcoming a new family member in, some kind of outstanding personal achievement, a positive change in financial status. These also rank on the scale of being stressors. I looked it up. Giving a presentation is about a 37. Giving a presentation at Horizon House is a 49. So what I can also tell you is that if there are some cutoffs for this scale. So if you were to go through and rank, yes, this is true for me, and then take that number value and sum those things, 150 and below, low risk of developing a stress-related health condition. So something like hypertension, heart disease. If you have a score of about 150 to a little less than 300, you have a 50% chance of developing one of those health conditions in the next 2 years. If your score is over 300, it's an 80% chance over the next 2 years. And this has become a huge area of interest in the medical community as people have realized that, boy, you know, there are these diseases that should be treatable. High blood pressure, high cholesterol, heart disease. We've got treatments. And yet for a lot of people, those treatments don't work like they are supposed to, or the large-scale clinical trials would say they do. And the piece that's been missing is an assessment and an address of stress, informing those diseases. Next slide, please. And you can click through this one. There's a couple of, I wasn't aware, I forgot that I would not be doing my own slides, so I'm gonna have to ask you to click a few more. There should be some, no, nothing? Oh, there you go. Okay, there we go. Okay, there we go. Thank you. So temporal sequence of stress too. Do things happen kind of quickly and then they fade? When we are faced with a stressor, we have this part of our system, our central nervous system, the sympathetic nervous system, that activates us and prepares us to either run away from that threat or fight or deal with it. And that is a very biological kind of response to a stressor. We also have, when stressors, and the same is kind of true for pain. And any of you who are dealing with chronic pain, which I'm guessing there are a number of you in the audience, know that when you first experience that pain and that onset, it's distressing, it hurts, it's not pleasant. But as pain becomes chronic, there's a very different kind of experience of that. And our experience of chronic pain is typically accompanied by other negative emotions and negative experiences. Chronic stress also shapes the way we interact with others, and a tendency to either perceive negative intent or perceive threats when they're not present. Wonderful set of studies that had someone interact with someone else with a very neutral expression. And if the people had been, the participants had been engaged in a pleasurable activity before that, they tended to rate them as more positive and supportive. If they had been exposed to significant stressors, they interpreted that negative expression or flat expression as negative. So we perceive things differently. And certainly, if you were to measure levels of stress hormones like adrenaline and cortisol, production gets upregulated in the presence of both acute and especially chronic stressors. So lots of things that are well validated at this point and pretty well understood. Next slide, please. We also understand that our central nervous system responds in very key ways as we experience stress. And these things change depending on whether those stressors are acute and temporary versus they're ongoing and chronic. So our fight or flight system, our sympathetic nervous system prepares us for action. We get increased blood flow to the extremities to prepare to either run or fight. We kind of shut off our digestive system and allocate resources elsewhere. Typically when that stressor is over or we're kind of back to baseline, our parasympathetic nervous system kicks in and shuts off that sympathetic activation, and we kind of come back to homeostasis. Everything from the adrenal glands all the way up to the brain respond with productions of different hormones and neurotransmitters. Organ function changes slightly. And this system has been refined so carefully over ages and ages as part of an evolutionary process that's very adaptive, right? We are primed to respond well to stress. That's a good thing for survival. The problem is when that system responds to not just actual threats or stressors, but perceived or anticipated ones. And the reality of our system is it doesn't matter if it's a bear in front of me or if I imagine a bear, I get a similar kind of level of activation, particularly if I've had a scary encounter with a bear in the past. You know, and some of this is the genesis of PTSD and the way the body and the brain respond after trauma, significant trauma, that dysregulation of our fight or flight system. The good news is, just as our brains are plastic and adaptable from experience to help with learning, right? You want to remember where you encountered that bear, so maybe you take a different path next time. Our brains also are very good at learning ways to help turn on that parasympathetic system to shut off some of that fight or flight activation. So it goes both ways, but it takes practice. Next slide, please. We also know that central nervous system, both of those sympathetic, parasympathetic branches, respond in a couple of key ways. One is that a threat or a stressor in the environment raises blood pressure temporarily. Chronic stress tends to raise it fairly consistently and permanently. It also elevates heart rate and it triggers platelet activity, so clotting may be a little bit more risky. So lots of ways that we raise risk for other things like stroke or heart disease. We know that our endocrine system is highly interactive with cortisol, that stress hormone, and that insulin production goes up, blood sugar levels go up, cholesterol production and accumulation goes up, and cognition goes down. There is some evidence that chronic stress may contribute to amyloid beta production and as well as maybe tau production. There's early days on that, especially if sleep is impaired and you don't have that ability to clear some of those things out. And certainly our immune systems take a hit when we are stressed. Given my last couple of weeks, I would be amazed if I didn't get sick this weekend. So we'll see. But it happens. And I'm sure some of you can think of times where you went through a very stressful period and then got sick afterwards. Usually just a cold and nothing, catastrophic, but certainly an effect there. Next slide, please. We also know, after years and years and years of research around the interactions between stress and other conditions, that they co-occur and keep company with things like anxiety, depression, obsessive compulsive disorder, panic disorder, eating disorders. I mean, these are all things that either give rise to, sustain, or exacerbate some of the most common mental health conditions that are part of our culture and society. We know that stress reduces wound healing ability. and interesting to see places that are going to do elective surgeries or cardiac surgeries assessing not just your blood pressure and your ejection fraction, but also how's your social support, how's your mood, how are your anxiety levels, are you smoking? These all affect how we heal. We know that people with chronic stress are also more likely to have upper respiratory problems, asthma, thyroid problems, and anything that interacts with those hormones is potentially shaped by this. And as I mentioned, potentially Alzheimer's disease and other neurodegenerative dementias. Next slide, please. And the reason for that is found in a couple of places, or at least some evidence for that is found in a couple of places, including animal and human models. So I'll walk you through these slides. I promised I wouldn't walk around too much, but I got to do it. So here, these are neurons here, and then we've got kind of the picture of the whole brain. But so a neuron, if you think about a brain cell, it's different than the typical cell in your hand or your arm, where there's a cell body, there's a long tube called the axon, and then there are these kind of tree branches called dendrites. And the way cognitive function happens, or brain function happens, is something electrical happens in here, which sends a charge down here, releases chemicals that connect with another neuron, and patterns of activation happen from both electrical and chemical activity. And the more of these you have connecting with the cell body, the more robust that activity tends to be. And what you see in animal models and human models exposed to significant stress is that these things die off in chronic stress in some parts of the brain. So the hippocampus, which is key in short-term memory, the medial frontal gyrus, critical for attention and concentration, they get bigger in other parts of the brain. So there's actually this response of increased, what's called dendritic arborization, where you have more connections between cells. And those tend to be in places like the amygdala and the orbitofrontal prefrontal cortex up above your eyes here, which are critical components of our threat appraisal system. So that part of the brain that is constantly looking for or responding to threats in the environment is getting stronger based on chronic stress. The problem with that is that kind of hypertrophy can't go on forever, and after a while, they start to shrink also. So you've got degeneration in cells and actual cortical structures that are responsible for memory and maybe some other cognitive functions, complex attention, freedom from distractibility. And then you've got this expansion of the areas that are the threat kind of network, but those ultimately suffer also. This comes from the PTSD literature out of the VA. This comes from people living with chronic trauma and PTSD, and then certainly animal models. So when you start thinking about how this interacts with the way we think and then function, and then other diseases that affect some of those same structures in the brain, one thought is that if I'm somebody who's going to get Alzheimer's disease when I'm 75 or 80, if I am chronically stressed and have too much cortisol, too much adrenaline, not enough brain-derived neurotrophic factor and other things, I am going to open the door to that earlier. And maybe now I'm 65. So that's one potential in terms of how these things interact. One more slide, please. The other thing I want to acknowledge is that many of you are care partners to somebody with memory loss or physical problems or other diseases, or to children who have health problems or grandchildren who have neurological or health problems. And one of the things that I am particularly aware of is, A, how hard that job is, and B, the risk for caregiver health problems and burnout. And the way I think of it is, if the caregiver's health fails, the whole system fails. So things that we can do to help bolster the resilience and health of care partners is critical. And burnout is a little bit of a culturally constrained topic or an idea, but it's pretty common in that it's accompanied by a number of domains where people just feel absolutely exhausted. Like, I have no gas left in the tank. It's a physical exhaustion. I am emotionally exhausted. I'm starting to have memory problems or can't focus. There is typically an accompanying change in attitude where people become indifferent to the care recipient or maybe even angry. There is often guilt about that, boy, I understand why this person needs the care they need, but I can't do it. And then I feel terrible. That means I'm a terrible spouse or a terrible adult child or terrible grandparent. And then doubt of, well, maybe even the things I'm doing to help aren't that helpful because I'm not that good at it. So we start questioning our own abilities. Here are some symptoms. Hopefully not too many of these resonate with you, but things like fatigue, withdrawal from activities. The fact that you're all here today is a good sign. Irritability, occasional thoughts of wanting to harm yourself or the person you're providing care for, which can be terribly distressing to have those thoughts. But these are things that occur as we start to experience burnout. We also stop sleeping and getting our own medical care and taking care of ourselves. And sometimes that piece of I need to take care of myself feels selfish or like it's a luxury, whereas it's absolutely critical. Next slide, please. People who are at risk for caregiver burnout, and again, I'm including this as an example of a pretty significant stressor. This is a very stressful scenario, being a care provider, caregiver, care partner. One is role confusion, right? Where I don't know how to be a spouse and a caregiver. I don't know how to be a parent or an adult child and a caregiver. So there's this kind of, I'm not sure how to do both. They don't seem to add up. The other is unrealistic expectations that I should be able to do all this by myself. I should be able to help with transfers. I should be able to help with toileting, whatever it may be, keep track of the medications, the finances, driving. No one person can do all of that, especially as you start to have your own kind of physical challenges. A sense of lack of control raises risk for caregiver burnout. There's nothing I can do about this. This is the situation I am stuck in. And then unreasonable demands. And these are sometimes internal, that, I have to do this and I have to do this first before I can do anything for myself. It could be unreasonable demands by the person who's receiving care. It could be the family. So a variety of possibilities there. But these are risk factors for caregiver burnout. The earlier we catch it, the better. Next slide, please. So when we start thinking about management and prevention, ideally, and you've all heard this in other contexts probably, but an ounce of prevention is worth a pound of cure. And that is absolutely true when we think about preventing burnout. Better to prevent it than try to come back from it. Number one is you need support and having people you can talk to, both professionally and a group of trusted friends, other people who are going through similar situations. It's amazing what you can learn from each other. Setting realistic goals. The idea of self-care isn't, a 2-week cruise. It's maybe a couple hours out on your own to go exercise or take a walk. The acceptance of I can't do this on my own and I probably need some help, and then accepting that help when it's offered. One thing I hear from caregivers frequently is I'm the only one that he or she will trust, and I'm the only one that can do it the way he or she likes. Yeah, that may be true to degrees. And without giving somebody else a chance to learn how to do that, we're kind of stuck. And certainly plenty of other recommendations. I meant to mention this earlier too. I am happy to leave an electronic copy of this with your fantastic committee here. And they're welcome to distribute it as seen. I didn't want to kill too many trees and print all these out. So one more slide, please. And I think there's 2 clicks on this one. 3 clicks, I'm sorry. One more. All right. Yep, there you go. All right. And I'm also, I realize you've been inundated with this on table tents and other places. I've had a few people tell me that all the marketing for stress talk is stressing them out. So it was an opportunity to maybe practice some of these things. We wanted to ramp up the stress levels. So I think of stress as just part and parcel of the human experience. There is no way to avoid it. I'm always perplexed by, eliminating these programs that offer to eliminate stress from your life and how you do that. I have no clue how you do that. I don't think that's humanly possible. So it's not avoidable. It is absolutely uncomfortable. And ideally that discomfort is something that drives you to think about other things to do versus just, I have to tolerate this and kind of, stick it out. Stress can absolutely be unhealthy. And, we talked a little bit about the effects of chronic stress when those hormones and other things are dysregulated, what that does to our organs and our physiological function. And most people would say, yeah, if you give me the chance to not engage in something that's stressful, I'm probably going to take that. But I would also offer you that stress is actually good for you in ways, to degrees, and we'll talk about that in a few minutes, as long as it can be managed. And that is not a perfect process where it's always kind of managed. I think about, blood sugar levels, right? For anybody with insulin resistance or diabetes, the goal is to keep your blood sugar levels kind of like this, right? Instead of the big spikes and drops. And I feel the same way about stress, that it's kind of like this. Maybe there are some down periods and maybe some up periods, but by and large, it's manageable. And it is, believe it or not, it's necessary. So we don't function well when we're under stressed. And of course, it is a very, very natural part of our experience. I will also share with you too, even though there's literature that examines the what's effective in managing stress or dealing with the physiological effects of stress, these are large-scale studies that put a lot of people together that obscure some very important differences. So it's kind of like medications, particularly some classes more than others, where everybody responds a little differently. And same thing for stress management techniques or strategies. There's no one size fits all. I did put this cartoon on here, and if you can't read it from where you are, it says, could we up the dosage? I still have feelings. So the goal, and I do not put this on here to poke fun at anyone who is taking any medications to deal with physical discomfort or emotional discomfort, but I put this up here as a reminder that really our goal, I think, is to enhance resilience and maybe improve stress tolerance while working on the things that are causing stress. So it's a both and. I'm a huge fan of the concept of grit and determination, perseverance despite difficulty, and things that we can do or others can do with us to help enhance that kind of resilience. That's a core skill, especially right now. One more slide, please. So there's also a growing movement and kind of interest in the benefits of stress. And that seems a little counterintuitive. This is a great book, if you haven't read it, called The Upside of Stress. And the findings are that when stress is moderate, so it's not severe, if we think about that scale of 100 being the death of a spouse, one of the lower ones was maybe a new change in your environment or something like that. But if it's in the moderate range, if it is short-lived, so if it's very temporary, if you have a sense of control in that this is, and also this kind of more external focus, that this isn't something that is happening within me, but it's a temporary external thing that is both going to pass and that I have some skills to cope with it while it's occurring. That is the recipe for stress being beneficial. And we know that the more social support and social connectivity you have, the better people tolerate stress, and the more of a benefit it tends to be when it falls into these other categories. Isolation, and boy, the pandemic has driven this home in so many ways. Isolation is so harmful in so many ways, including decreasing our stress tolerance and ability to deal with the things in our lives that we can't get rid of or we can't take off our plates. So that's another kind of a metaphor I think of people are like, well, you should take that off your plate. But a lot of things we can't, right? Chronic diseases, death of a spouse or a close friend, those are permanent, maybe to degrees with diseases. So there are some things that were going to remain on your plate. So how do we make your plate bigger and thicker? Next slide, please. So you can kind of think of it, for those of you like myself who are visual learners, you think about it in terms of this curve, that too little stress, too little activity, we get bored, and both our performance and our function declines. Too much stress, and we get anxious and incapacitated and overwhelmed, and that's not good either. But there's this sweet spot of what's the optimal level of stress. And unfortunately, I don't think anybody can tell you exactly what that is for you. You may know from experience, trial and error. But we also see this in a couple of places, but including cognitive testing. When we ask people to do these hours of different tests to figure out is what's happening normal or not, that's a stressful experience. And a lot of those measures are meant to provoke just the right amount of stress and challenge to get optimal performance. Something that's too hard, you're going to stress out and be anxious, and that's going to interfere. Something that's too easy, sometimes people are, I'm not going to do that. This same principle, does anybody here do like Lumosity or Brain HQ or those like any computerized cognitive activation? They're designed off the same principle where the difficulty is always calibrated to be right at that moderate challenge level based on your performance. So that's maybe one of the active ingredients about why these work. Next slide, please. Okay, so you all have your own frame of reference for stress. We've talked a little bit about what goes on in the body and the brain and the mind as a function of that, and the importance of managing stress. Can't eliminate it, can't always prevent it, but ideally you can manage it. And when we think about what has any decent data, and there are a lot of things I want to caveat here is there are a lot of things that work for people that haven't been studied in the classic sense of a randomized control trial that you can look at, magnitude of a treatment effect. But when you look at the literature around stress management, there are three, four big ones that pop out as effective. The first and foremost, probably the most return on investment is physical exercise. The challenge with that is not everybody can engage in physical exercise, at least to the same degrees, due to mobility limitations or musculoskeletal orthopedic issues, cardiac issues. But even things like Tai Chi, yoga, anything that's movement-based seems to have some benefit. That which is cardiovascular in nature, so getting your heart rate up, has additional benefits. So there's physical activity, absolutely some kind of a connection to something larger than yourself, some spiritual practice. Doesn't have to be organized religion, but that works for a lot of people. That's just fine. Prayer, transcendental meditation, and then these different classes of meditation, which have been studied more and more over the last, since the late 70s, particularly in relationship to stress and stress-mediated health conditions. So there's more contemplative types of meditation. There's more what I would think of as cultivating attention and awareness, which is mindfulness falls into that category. There's certainly some kind of analytical or insight-based ones. And then some people really love, things that involve like a mantra or chanting or, so again, whatever works for you. And then, other things that have some good data are being in nature. So that kind of, again, connection to the larger world. A gratitude practice. That's one of my absolute favorite things. Tough to do when you are stressed out and dealing with things that aren't so positive. But I would encourage you, if you don't have a gratitude practice, it's an interesting one to take stock of the things that are either working well or that you're thankful for, and not to negate all the other things that are difficult or stressful, but just an appreciation of the whole picture. That helps with kind of seeing, stress in a different light. I'm going to focus on two of these. Next slide, please. One just very briefly. So this was a landmark article. It's quite a few years ago now, but it was published in the Journal of the American Medical Association, which, for those of you who are familiar with that, it's one of the paramount journals for the medical organization. High criteria in terms of quality of evidence to be presented in that. And this was a lovely study looking at cardiac function and cardiac disease, usual care, so follow up with your cardiologist, your primary care provider, compared to usual care plus cardiovascular exercise or usual care plus stress management training. And what they found was that those who engaged in the exercise was about 35 minutes a week, 3 times a week, 16 weeks. Stress management was learning some strategies to help activate your parasympathetic nervous system, kind of think about things in a slightly different light, some more cognitive behavioral interventions, hour and a half a week for 16 weeks. And what they found was that both exercise and stress management training were more effective than usual care on things like ejection fraction, wall abnormalities, your baroreflex sensitivity and heart rate variability during sleep. So these are pretty good indicators of cardiovascular health and overall health, and better metrics overall for those who did this. And the age is 40 to 84. So it was an impressive study. It's been referenced, many times. And you can find study after study after study looking at, what does cardiovascular exercise do for us in terms of stress. Great treatment if you can do it. Again, as somebody who works with a lot of people with mobility limitations, not everybody can exercise, at least to that level. Next slide, please. So if we think about, why that is, and if you look across those studies looking at exercise and stress management, the things that happen when we exercise is those stress hormones of adrenaline and cortisol, we decrease production of those. We increase production of things like our endorphins. Anybody used to be or still a runner? Did any kind of running? You hear about the runner's high, right? This kind of elation that people get after they went for a long or hard run. You've activated the body's natural opioids and endorphins, and people are like, it's kind of like being on drugs. It's this real addictive kind of high, physiological high that people get after exertion. You've also upregulated dopamine and serotonin, which is why exercise is also one of the preferred treatments for depression, although it's hard to exercise when you're depressed. People typically feel better after they exercise. Part of that is I am doing something. This is something that I can do and have some control over. So there's a sense of self-efficacy that comes with exercise. I get to pick when I do this and how I do it and what I do. So there's some autonomy and self-control. Sometimes people lose weight and they feel better about the way they look. Whatever the motivation is, it's great. But all pieces of why people tend to manage stress better after they exercise or after they've been exercising. The other interesting thing that has been of interest for a bunch of researchers lately is that it really is a form of meditation, that you are in the body when you're exercising, for better or worse, in terms of if it hurts or you're tired, but it is this shifting of focus away from the things we worry about or think about to, boy, when I'm doing this activity, all I'm thinking about is this activity, and that kind of being in the zone and being able to focus on something external or something different internal. And when we think about meditation, particularly mindfulness meditation, that is one of the components of why it is effective in stress management, is that ability to shift out of the story, the worries, rumination, worst case scenario, catastrophization, whatever's going on, to something else. All right. So next slide, please. And I'm curious, how many people here are familiar with mindfulness meditation? Oh my goodness. Wow. Maybe that's why you came. I don't know, but that's a remarkable number. And the Fry had been to that back when it was in person, and okay, good, very good. Yeah, I've had the privilege of leading the mindfulness meditation for the last, I think, 5 years now, and would frequently attend when I was at Virginia Mason and I could. And it's wonderful to see so many people coming back out for that. And thank you for those of you who come. So you've got an awareness of it either by personal experience or maybe background or just being saturated in popular culture right now. But I wanted to talk a little bit about how it pertains to stress management. And I kind of want to talk a little bit about what I see it to be and what I don't. So my experience with mindfulness meditation goes back to about age 10, and I am 48 now, so that's a couple years. It's interesting to have seen both my own kind of relationship with it and how it's filtered out into other parts of our world, including the medical community, medical care, which is not new, but boy, it's picked up quite a bit. So I think of this as something that is rooted in Eastern practices, but not tethered to it. One of the things I like about mindfulness meditation is it is flexible. It's not a replacement for other spiritual beliefs or practices. You can do a variety of things in a variety of ways. So that flexibility, I think, makes it very adaptable and makes it more personal. I also think of it as potentially really just a form of attention training. And when you think about the core practice of mindfulness, it is cultivating attention to some aspect of the present moment. And we've got, three things potentially we could pay attention to. The BMW model, right? The body, the mind, and the world. So I could pay attention to the sensations in my body, like, the back of my neck with clothes on it, or my feet on the floor. Breathing is often an area of focus. I could pay attention to other things in the world, like sounds, which happens to be one of my favorites. I could pay attention to other internal experiences, thoughts, emotions, my own thinking, all happening sometimes intentionally, sometimes not. But really just that cultivation of paying attention to that thing, whatever's happening in the here and now, and not the there and then. So not something in the past or what might happen in the future, but that momentary awareness. And then each time I start thinking about, oh man, I got to get back to clinic because I got this thing at 4 o'clock. Right back to my breathing, or right back to the person laughing over there, whatever it may be, right? Whatever aspect of the moment you're paying attention to, and not judging myself or criticizing myself that my mind has wandered, which I think is kind of the natural activity of the mind. That's what we do. Our minds are constantly, and that's part of the default mode network that we have, which is our minds just kind of wandering. They're meant to do that. That's an adaptive thing. Where I think we get into trouble is when we're stuck on worrying about, oh my gosh, if my memory problems are this bad right now, what are they going to be like in a year, 2 years, 3 years? If my back is this bad right now, am I going to be able to walk in a year, 2 years? We don't live a year, 2 years out. We live right here and now. Having some view of that's probably adaptive. But if it makes me anxious, interesting thing about anxiety is that it's always future-based versus fear, which is present-based. Or, boy, I used to be able to run marathons, and now, it's hard for me to walk from here across the street. That kind of what was. And that's a recipe for depression, right? The comparisons of I used to be able to do A, B, and C, now I can't. Versus, okay, if those things are true, what can I do now? I also find mindfulness a really interesting opportunity to move out of the doing phase that we're often in, or at least I am often in, and just in the being phase. One of my favorite phrases is don't just do something, sit there, right? So, and this one's a little tricky, but also the non-judgmental awareness and maybe even acceptance to a degree, not that you don't do anything about it, of what is going on in this moment. So often, when people are doing mindfulness practices, they're competing with back pain, leg pain, numb foot, whatever it may be, GI problems, and those things are clamoring for our attention. And that ability to sit there and notice them without being consumed by them or having to try to fix them or push them away, it's a challenge, but it's such an essential skill to be able to at least appraise them accurately and then think about what might I do about this. So we'll come back to acceptance in a minute. It also emphasizes making contact with those things versus trying to push them away, that kind of avoidance. And when we think about anxiety or trauma or stress, often the response is, I didn't want to deal with it. I just want to push it away, which doesn't work. I mean, maybe in the moment, and your self-care comment reminded me of the difference between self-soothing and self-care. And it's important to know which one you're doing when you're doing it. Next slide, please. And then, perfect. So, and then one more click. I think there's a little text at the bottom there. I'll take out the animations for the next one, I promise. All right. So mindfulness and meditation, I think in general, are not an escape. They're not just a different way to avoid things. So you're not tuning out or dropping out. It's absolutely not a practice of trying to empty the mind of all thoughts. Good luck. I don't know how you do that. I mean, again, the natural activity of this organ is to produce thoughts. That's what it does. What you do with those thoughts, whether you buy into them as reality or you act on them, that's a different story, right? Mindfulness is not competitive. Nobody's been sponsored by any meditation companies, I don't think, although maybe there's risk of that. It's also, even though it yields relaxation sometimes, that's not the purpose of it, right? So there are these ancillary or incidental benefits of meditation including sometimes being more relaxed or more present or calm, centered, whatever may come from that, but that's not the purpose. So it can happen, but that's maybe not the goal of it. Certainly it's not exclusive. I'm always a little bit, I kind of smile when people say, oh, I tried it, I'm not good at it. You know, it's a practice. It's not a mastery event. You know, I think about it almost the same as learning to play an instrument, right? You don't take one piano lesson or piano lessons for a month and then go out and play Beethoven's sonatas. It doesn't work like that. And meditation is similar. It doesn't take, 10,000 hours of practice maybe, but it takes practice. There's a reason it's called a practice. The other thing that has been a criticism of mindfulness recently, and one thing that it is not, is just a technique to enhance your own resilience or kind of coping abilities without also investigating the things that are causing us distress. So there's lots of ethical issues potentially around companies that, like Google or Amazon, not to pick on them, but Microsoft, other large corporations that are offering their employees mindfulness training to make them better workers. Or the government offering mindfulness training to make soldiers better killers. In some ways, people that are in very stressful and potentially traumatic jobs, to give them some resilience, like law enforcement, firefighters, that makes some sense, but really need to think about what is the ultimate purpose of this? What's the ultimate benefit of this? And, should you have someone who's experiencing ageism, sexism, racism, just work on mindfulness to enhance their resilience without trying to fix the things that are causing that? Absolutely not. So that's my complaint, and some complaints about mindfulness divorced from self-compassion or compassion for others. So, all right, next slide, please. A couple of great definitions from people that are far more qualified to define it than I am. Mindfulness means paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. That comes straight from John Kabat-Zinn out at University of Massachusetts. And then another one, which I'm particularly fond of, is that life can be found only in the present moment. The past is gone. The future is not yet here. And if we do not go back to ourselves in the present moment, we cannot be in touch with life. So again, this is where we operate, in this moment right here, not an hour from now, not a week from now, not a year from now. And this is where we have an opportunity to affect some changes. Can't fix what's already happened. That's way back there. One more slide, please. I'm pretty sure I came up with this, and if I stole it from somebody, they deserve credit, but I think of it as the what is, not the what if or the what was. And I put these little kind of discs here as kind of a reminder of, sometimes, and especially the further back we go, the more distorted that view is, or the further out we go. It's almost like if you're in a pool of water, you have a fantastic pool here, you can try this out. You're in a pool of water and you're looking at something on the surface, the deeper you go, the more distorted that image becomes. And I think of that, again, as a kind of a metaphor for things that we've done way back in time, or that might happen way out in time. And our view of those things typically is not very good or not very accurate. Next slide, please. Some of the core attitudes that help with a mindfulness practice. I'm just going to cover a couple of these. You easily can read them as well. One is that non-judgmental piece. So when my mind wanders for the 100th time in 5 minutes, it's not a self-criticism. And similarly, it's not a self-congratulations if my mind hasn't wandered at all in a few minutes. That's not part of this process. Absolutely patience. The idea of the beginner's mind, which is another thing I try to keep in mind, especially in clinical practice. As I've been doing this now for over 20 years, it's easy to have preconceived notions about what's going on with somebody. That's one of the things I love about working with students is they think about everything. It's not maybe just this, but it could be this, or what about this rare thing that only happens to 1 in 10 million people? Could it be that? So that idea that, multiple possibilities. And the other thing is the non-striving piece. And this is a tough one because and I realize we're talking about, stress management, effective stress management. If you approach a meditation practice with the question of how long is it going to take to help me fall asleep at night, How long do I have to do this before I feel like my stress levels are lower, my anxiety is better controlled? You're going to be sorely disappointed, right? And people give up because it's quote unquote not working. So that kind of striving for some outcome or some product or benefit, it happens. It is a kind of a incidental downstream event that happens. Can't tell you when, can't tell you exactly how much. So that kind of, I'm doing this with kind of trust that it's a good thing to do. Although next session we can talk about what does it look like, you know, after 6 months or after a year maybe. Next slide, please. The other thing I would want to make sure we're clear about is that the techniques of mindfulness meditation are pretty flexible, you know, so it's not just a body scan, it's not just, you know, awareness of the breath, it's not just a gratitude practice or paying attention to sounds. The core of this, the commonality is the mindful attention of the moment, intentional attention to the moment, and returning back to that without judgment or criticism. And having compassion for yourself while you're doing this, because it's not easy. It's simple, but not easy. So it is a practice. And next slide, please. So if we talk a little bit about some of the data, and part of me feels a little bit, you know, why do we need randomized clinical trials and fancy brain scans and telomere lengths and all those things to, you know, lend credence to something that's clearly got plenty of credence just on its own accord. But these are interesting things. And it is interesting to see how it's filtered into healthcare and how we take care of people with chronic conditions. And we always want to be doing something that helps and works, and it's part of evidence-based medicine. So this, as mindfulness pertains to stress-related health conditions and stress itself, this came out of the University of Massachusetts Amherst in the work of John Kabat-Zinn and colleagues in the mid-70s with the first publication in the late 70s. So this has been around for a while. And as I mentioned earlier, there were all of these concerns about, boy, we've got these conditions that should be easily treatable, yet people's blood pressure is still super high, their cholesterol levels are through the roof, they're having heart attacks, and they've got chronic pain with no focal correlates, they're on all the right treatments, but their pain's uncontrolled. We have these antidepressants and anti-anxiety medications, but people are still stressed and depressed and anxious. And as this clinic, the stress reduction clinic, came up and running, and that's honestly, as somebody who has worked both in physical medicine and rehabilitation and a neurology clinic, one thing that happens and used to happen more is we've tried all the usual things, we don't know what to do, let's send them to the psychologist or the psychiatrist. That was often, in some places, not an appreciation for the role of a behavioral health component in other diseases. And this was one of those clinics where people that we don't know what to do with you, this is this other clinic we have, let's try that. Very quickly realized that stress was the common denominator driving a lot of these things. So this became, over time, the Center for Mindfulness in Medicine, Healthcare, and Society, and really pretty quickly worked its way into the treatments we have for depression and anxiety. Next slide, please. I'm not going to go through these in detail, but here's just a sampling of the mindfulness-based stress reduction programs and some of the evidence. There's a lot of great articles about that, really more for your resource and reference if you're interested. Next one. There's also been a big shift in some of our traditional psychotherapies to include mindfulness and with some nice improvements in efficacy and treatment size, treatment effect size. Next one. Another very early adaptation was in substance use. And a lot of this work came right out of the University of Washington with Alan Marlatt and folks in his lab, who's someone I worked with back in the late 90s and really appreciated that opportunity. I don't know if any of you ever had the opportunity to meet Dr. Marlatt, who has since passed away, but one of my favorite memories of him was in long meetings, he would often be sitting kind of like this, and the table would kind of look at him. And it would be quiet long enough that he'd finally open his eyes and say, oh yes, I was just meditating on that. He's pretty asleep, but he did a lovely job of rolling right into it. All right, so yeah, a lot around substance use and relapse prevention. That was a big area of his too, maintaining abstinence. All right, and then one more slide. In a kind of a more treatment-oriented way. When I was across the street in the physical medicine rehab department, part of my job was working in the pain clinic. And there was lots of interest around that time and some new evidence that meditation was also an effective treatment for chronic pain. Not acute pain so much, although some data around that too. And much interest in, well, why would that be? So if we have people on a good program and they're medically stable, they're on all the right medications, those are all stable. And then we add this component of mindfulness training, their ratings of pain go down about 40%. So it's not an on-off switch for pain. It's not like hypnosis or some other modality, but it's like people can turn the volume down on the intensity of that pain. And they especially turn the volume down on the story that they tell themselves about how terrible the pain is, which is a driver of why chronic pain feels worse than acute pain sometimes, even though the magnitude or the injury may be the same. And what was found from a couple of really lovely studies with relaxation as kind of a control group is that a mindfulness practice helps re-regulate the connectivity between some of the pain processing pathways in the body. So that area that I mentioned, the anterior cingulate gyrus, parts of the medial frontal cortex, the relationship between those and the thalamus, which is kind of the relay station from all of the spinal nerves that go out into different parts of the brain. That network that's involved in nociception or pain perception, you can remodulate that. And as people are in pain for a long time, it becomes hyperactive, which is like a feedback loop in terms of the subjective experience of pain. So teaching people how to turn the volume down on that brings it back down to kind of whatever's going on in your spine that's causing those problems. So fascinating, good stuff. And the problem is you have to do it. I can't meditate you. It's like if we go to a restaurant, I can't eat the meal for you. I can, but you're not going to like it, right? I mean, but you can teach people how to do this. You can help them do it. So, all right, next slide, please. Nope, we already saw that one. Keep going, if you would. It was so good, I put it in there twice. How about yeah, there we go. As this pertains to treating things like depression and anxiety, if any of you have ever engaged in cognitive behavioral therapy, the traditional form of this was you should identify all these negative thoughts you have about what you should or shouldn't be doing, or musts, or the kind of quote unquote maladaptive thoughts. You should wrestle those into submission and replace them with more adaptive thoughts while you're going out and doing pleasurable things. And that's a gross oversimplification of CBT, but having been trained in that long ago, that's not too far off. So you identify these thoughts, you examine them, what's the evidence for them, against them, you replace them with more adaptive thoughts. People have a hard time with that, especially if you don't believe those more adaptive thoughts. Next slide, please. When you think about how to modify that with mindfulness, it may be I have these thoughts about how terrible of a person I am, or the world is, or the future is, which is a classic triad for depression. You notice those thoughts. The imperative is not that you're not going to have them. You shouldn't have them. That might be too tall of an order. But I have these thoughts. I accept that I have them. I accept that they're just thoughts. They're not necessarily fused with reality. And then you shift your attention back to something else. And you might have the same thought 3 seconds later. You do the same process and you bring it back. So it's not I'm going to replace these with something more adaptive. It's like, wow, I've got a lot of experience having these thoughts. I'm pretty good at it. Doesn't mean they're true. And I have some compassion for that. And now I'm going to return my attention to some other either external or internal stimulus that is less distressing. So slight modification, but impressive and important. Next one, please. The other things that are critical to help with this, and we've already talked about non-striving and non-judgmental, self-compassion. Absolutely important to make sure we are making contact with that part of us that is worth taking care of, that we are doing the best we can, typically under very difficult circumstances. If you can't look yourself in the eye and say you're doing the best you can, maybe that's cause to make some changes or work on some things and have some compassion while you're doing that. But often, the concern is the opposite, that, I need to be self-critical because if I let myself off the hook, I'm not going to do the things I need to do. Very few people fall into that boat. And a dose of self-compassion is a good one, a good antidote for self-criticism. And again, this idea of not impartial or not, kind of no emotion whatsoever, but this sense of detached curiosity. So not just, I'm having these thoughts about myself, that I'm a terrible person and the world's terrible, I'm a terrible caregiver. Oh, that's interesting. I'm having those thoughts again. So not that I don't care and I'm just going to try to be completely neutral about them, but oh, that's interesting. And one of the downstream benefits, I think, of a mindfulness practice is we often operate from a stimulus reaction kind of framework. Something happens and I react a certain way. And some of us have very established kind of reactionary patterns to those things. And not that you have to change that, but if something like a mindfulness practice can insert a little bit of distance between that stimulus and, the reaction may come up, but that, that's interesting. My reaction is to tell this person to go take a hike or whatever it may be. Is that what I really want to do? Is that the most adaptive thing to do? No, maybe I could do this. Oh, maybe let's try this, right? So a little bit of distance in the behavioral chain there. But that, again, can't approach it as I need that to happen in 3 months. It comes with time. All right, next slide, please. And then we are very close to, oh yeah, one more favorite. Somebody stole that out of my office, but it was, don't believe everything you think. All right, a couple more here and then we'll turn it into a conversation. Okay, and then I think one more. All right, there we go. So the purpose, again, we're cultivating non-judgmental awareness of what is, awareness of our own reactions and the way that we tend to respond to things, as well as what the options might be and maybe what's better for you. Certainly not just a set of techniques to enhance resilience, but also a set of tools to really think about what are the things in our environment that are causing us distress, and either what can we do about those, what can we help others do, what can we have others help us do? So how do we fix some of these root problems that cause stress? So not just about tolerating them. I think management is changing what you can and then coping with the rest of it, right? So next slide, please. And there's a bunch of text on here, but I think all I'll highlight is that this continues as a process. So again, it's not a mastery event. There's lots of practice. There's lots of change that occurs. So this constantly investigating. I'm also struck, and for any of you with either friends or family or yourself dealing with changes in memory or Alzheimer's disease or another dementia, it is really a journey of constantly reevaluating. That, boy, this used to be the way things went and worked, and that doesn't work anymore. Now we need to do something different. And now that doesn't work anymore. Now we need to do something different. And the things that used to work no longer work. And the things that didn't used to work maybe now work in terms of helping with mood or activities. So this detached curiosity and continued evaluation, I think mindfulness is a great tool for that. And again, that non-judgmental of what is going on, what can I do about it? Next slide, please. So the importance of self-compassion, again, it's not letting yourself off the hook. I would equate it more to self-kindness, and it's easy, I think, for us to be compassionate towards others, harder to be compassionate with ourselves. It's more about acceptance. And again, not acceptance divorced from action or change, but that piece of here's where I am and here's what I can work on. Importance of connection to our larger human condition. So usually a self-compassion, mindful self-compassion practice is envisioning or offering, thoughts of loving kindness or well wishes to another, and then to yourself and to some larger group, and recognizing kind of your place in that larger group. It's one of the things I love about Horizon House is the community here. And again, I get to work with a lot of different senior living communities around town. And from your friends or your own experience, that's not the same everywhere. So it's really a special place here to be part of this larger, really wonderful and long-term community. You're all far too young to have been here when I did the first talk 20 years ago, but it was the same back then. So, yeah. Again, the importance of awareness and engagement. Next slide, and there's, I think, 3 kind of bullet points here. Yeah. I did want to talk a little bit about acceptance, because that's a tough concept sometimes, in that it gets conflated with or equated to giving up. That if I accept this, that means I'm not going to do anything about it, which it absolutely does not mean. In my mind, acceptance is really just the non-judgmental awareness of what is. That doesn't mean you don't do anything about it, right? I mean, we kind of have to accept the fact that it rains here for 11 months out of the year in Seattle, or 9. That doesn't mean you don't get a good rain jacket or an umbrella, right? That's acceptance. I have acknowledged that, yeah, this is what happens, and what do I need to do about it, right? So it's not giving up. It's not throwing in the towel. And it's also not just doing the same thing over and over again without any thought to, well, what else might I try? All right. Next slide. And there's one quote on here. I promised this person that I would put this quote in every talk. This was somebody who was living with MS. And it was just, I thought, a beautiful quote of, you know, I can't fight this, so I might as well dance with it and try to lead as much as possible. And I think that is such an elegant phrasing of acceptance that, you know, we'll do what we can. Okay, one more slide with some resources. And again, I am, my plan, unless I screwed this up royally and you're telling me not to come back next month, is to come back and talk more in depth about mindfulness in terms of how it interfaces with cognition and Alzheimer's disease and aging, particularly, and then talk a little bit more about some specific practices. But if you're interested or haven't seen these resources, there's some great local ones. So Mindfulness Northwest, there's the Seattle Mindfulness Center. You know, the Fry has more resources now online than they had historically. I think we recorded 38 different meditations over the last 2 years. I am deeply allergic to watching myself on video, so I have no idea how they are, but they're there. And then, of course, a couple of good either books or audiobooks, one by John Kabat-Zinn. The one on the left here, the Mindfulness for Beginners, is fantastic. The CD1 is a little bit of a dense academic overview of what is mindfulness. CD2 is a really lovely set of guided meditations, some 3 minutes up to 30 minutes. And then the full 8-week program in full catastrophe living. Then let's see, one more slide, which has my contact information. And 9 times out of 10, I am right there when I'm not in our new memory hub by the Fry. Email, phone number, all that stuff is current, up to date. And then there are about 5 or 6, maybe 7 slides of resources. I don't know if you want to click through those. I don't think you need to, but if you're interested in any of the literature or, kind of the science behind some of this stuff, there's about 70 resources in there. And I think that is, oh, that's a lot. That was it. There you go. We've got at least 15 minutes to chat a little bit. I would love to hear your expertise in how you manage stress, what's been effective for you, or questions. Or I've successfully, bludgeoned you with information and you just want to leave. That's fine too.
Raise your hand, please, if you want to speak. And when you do, we'll appreciate your keeping your mask on so we don't get cross-contamination of mics.
Sounds like oh yeah, go ahead. And I can also repeat your question if, or we can do that.
Thank you. So when you're talking about stress, are you talking about that which is happening now, presently, within the last several years, let's say, or are you also including that which happened, let's say, in childhood and in our lives long ago?
I would say both. Yeah. And I would say that that's a really wonderful question. So, is stress really just kind of stuff that's happening now, or does it also include things from the past? And I would say that the things that have happened in the past and what sense we make of those or don't make of those, how we've kind of fit them into the rest of our narrative of who we are and how we are, shape the way that we experience current stressors. And, stress can be cumulative, right? Where something that was a previous stressor that I haven't kind of made sense of, and I've just tried to kind of put on the back burner and get on with it, might shape how I deal with the current pandemic or, other health problems in my family. So it's a both and for sure. But what I would say too is that, there are plenty of instances and examples of people who have undergone tremendously stressful experiences in the past, struggled mightily with that, ultimately made sense of it and kind of what it is, what it isn't, what it means, what it doesn't, where it's not a huge variable in how they experience current stressors. And maybe a more kind of a concrete point. So there was a lot of interest for a long time about, so you've got this platoon of soldiers. They all go through a terrible experience. There are 10 of them. 3 of them develop post-traumatic stress disorder. The other 7 don't. They all went through the same experience. Why is that? And one of the findings is that, for those 3, there is a higher likelihood of childhood trauma, abuse, other mental health problems that set the stage to respond to stressful experiences differently. And that kind of complex polytrauma or complex polystress would shape kind of what's going on in the here and now and how we deal with that. Yeah. Yes.
Sorry about that.
Good catch.
Thank you. A lot of us deal with chronic pain continually. You go to your doctor and they say, what is your pain level from 1 to 10? It's hitting us all the time. How can you reflect a little bit more about the mindfulness in the pain management for all of us?
Absolutely. So, and there really is a wonderful body of literature around mindfulness meditation for pain. And that same John Kabat-Zinn with the Mindfulness for Beginners, there is a 2 CD set of mindfulness for chronic pain that he put out. And when you look at kind of evidence-based non-medication treatments, meditation and mindfulness is one of those. So, but it's a practice and it takes time, right? So it's one of those things of the better done studies would say somewhere in the neighborhood of between 10 to 20 minutes a day of a practice over about 6 months is when you start to see those changes in those pain processing pathways, turning down the volume on those. So it takes about 6 months and pretty consistent practice. One of the better studies that I saw done was dividing that practice into 2. So 10 minutes kind of early in the day, 10 minutes later in the day might help. And to some degree, for some people, not everybody, so this is not a promise, but if you deal with chronic pain, typically that pain tends to escalate over the course of the day as we're active and do things. And if you can intervene early, you can kind of reset it. So if your chronic pain went from maybe a 5 in the morning to a 9 by the end of the day, if you maybe midday did one of those sessions, maybe instead of a 7, it's a 6. And by the end of the day, it's only an 8, not a 9. It's very subjective, but it's that idea of kind of resetting that system and over time, learning how to turn the volume down on that. But again, practice. The other thing that is coming to mind is there were a number of studies that looked at a group practice versus an individual practice, more of an effect with a group practice. And that's true for a number of things, whether it's cardiovascular exercise, for memory loss. If you do it in a social scenario or setting, there's a bigger treatment effect than if you do it on your own. Not that it doesn't do anything if you're on your own, but it's that much better to do it in a group. Yeah. Oh, yes.
Just a little clarification. You listed a number of things that produce, positive things that produce stress. And I'm just wondering, does that stress affect the epinephrine and cortisol the same and produce the same effects in us?
It does, but for a shorter duration. Yeah, and typically, the experience would be that the positive things that cause stress are shorter lived. They're more in that kind of moderate, manageable level, but acutely, yes. Yep. Yeah. Yep. And the other thing that's kind of related to that, I was told earlier, never answer the question asked you, answer the one you want to answer. But hopefully I did answer your question. But I'm also reminded that well, let's go to the next one. Maybe it'll come up. Any others? Oh, looks like there's one down there.
I'm wondering if any form of acupuncture in your experience has any influence whatsoever on stress and levels and or pain.
Yes and yes. Yep. Yeah, as a matter of fact, most or many good interdisciplinary pain programs have acupuncture, massage, these kind of adjunct treatments in addition to traditional medical therapies. For stress, I'd have to go look at the literature. It's plausible in terms of how that same thing would work, but I'm just not as familiar with that. But yeah. And that's that too. I think we all respond differently to different things, and if that's a piece of the puzzle, I think about the risks of that, pretty minimal compared to the potential benefits. And problem is a lot of insurance companies don't cover it, I think, and Medicare does not cover it, acupuncture. But yes.
Are there any meds that help with stress?
Yeah, so certainly there are. My favorite part of my job is that I don't prescribe medications. And, I purposely chose the path I did for that reason. But yes, if you look at some of the other literature around, some of the antidepressant medications or anti-anxiety medications, but not the benzodiazepines, stress coping and stress resilience is rated as a little bit higher. So yeah, I also think sometimes, and you've got in-house experts about this, but I think about medications as often providing a little bit of traction to do some of the other things that we can learn to do or do that help with managing stress. So sometimes it seems like, we spin our wheels trying to do all these things are not helping enough. And if there's something that gives you just that much more of a lift or a boost to then those things take more effect or more hold, then certainly a good place for those there. Yes.
How do you make your acceptance of a change, your acceptance of not being able to do what you used to be able to do? You can accept that, but
doesn't mean you have to like it.
You're still miserable with it.
Yeah. Yep. Well, nobody said acceptance was easy, right? There's also nothing that says you have to like the things that you accept, right? I mean, I can accept something and not like it. I don't like the fact that it rains as much as it does here, but I accept it. And the other thing that I think is critical and that comes from acceptance, ideally, is if I can't do that, what else can I do? If it's not, and doesn't mean I have to like it, and where I come up against this, and we just had this conversation today. So a lot of the folks that I deal with have significant memory problems, which erodes their enjoyment of reading, something that they historically loved to do. So we talk about, well, maybe you can't read highly technical information or a novel with a lot of characters or plot lines, but reading is on a continuum, right? So there's that, then there's short stories, there's newspaper or magazine articles, newspaper articles, poetry, haiku. I mean, there's a continuum, and where are we there? And is it maybe just a book on tape? So it's not a giving up entirely, but where are we at? Yeah, but not easy, and not without emotion, for sure. Oh, over there. Oh, good.
comment, not a question, about Medicare and acupuncture.
Mhm.
Medicare will cover it
Oh, good.
if you get it from a medical doctor who's licensed in acupuncture. Of course, they have to go through the approvals, but I found that out very happily for myself.
Oh, thank you for that
And
clarification.
the Swedish hospital has a pain clinic.
They do. They have a fantastic one.
Yeah, and they'll do it there.
Oh, good, good. Yeah. Thank you for that clarification. Historically, that's been a big problem here of Medicare not covering some things that are evidence-based and well-known.
You mentioned some damage that occurs to the brain with chronic stress, and could you mention about how some mindfulness practices can improve neural functioning and well, just in general?
Yeah, as a matter, you've set me up perfectly for the second talk, but as a preview for that, couple of things. One is, again, our brains, even into our 8th, 9th decade and beyond, our brains are wonderfully plastic things. They become less plastic as we age, but we continue to produce new neurons. We continue to produce new connections between neurons, and some activities increase that production more than others. And what we give attention to, or what we practice, is where those things tend to happen. So either strengthening the connections that are there, or creating new neurons and kind of programming them into a role. Glue, like more of a stem cells, right? So we can take a stem cell, create that, and then channel it into a place where it's an axon serving a cognitive substrate. So hippocampus is a great example of that. So the middle of our temporal lobe, which is here above the ear, that's one of the areas where we produce the most new neurons. And things like exercise, meditation practice, which activates that region, strengthens those either production or kind of formation of those new cells. Then, if we use those, they serve that purpose. That's one of them. And the things about like cortisol and adrenaline, these are neurotoxic. The more of these things we have floating around, they do damage to our cells. So if we're decreasing the production of that, that's less neurotoxic. And we're stimulating things like brain-derived neurotrophic factor and a few other chemicals that stimulate production of either connections between cells or new cells themselves. And it's not the whole brain, but there are subregions and sub pieces of regions that are responsive to this. The other thing that comes with this, and I think, again, a downstream byproduct of mindfulness meditation, is increased selective attention abilities. And that's the exact part, and we'll talk about this more next time, but that part of our brain that is responsible for paying attention to this thing while ignoring that conversation going on over there, or the construction outside, or whatever it may be, that kind of focus without getting distracted. And that is a key skill that is a prerequisite for memory. So if I get distracted while someone's reading me a list of words or telling me what they want me to get at the grocery store, I'm less likely to remember that. But if I can hone that skill a little to be a little bit more robust, and I can process information more quickly and more efficiently, that also leads to some improvements in cognition. We have 30 seconds, and if I could be so bold as to take that time, just thank you so much for coming out to this. I know you've lots of choices and things that you could do, and no shortage of activities or committees here in which to do them. So I really do thank you for your time and your attention. Really, again, it's so great to be here in this capacity. And it's nice to see some familiar faces.
Thank you, Dr. Rhodes, for that excellent presentation. And as Dr. Rhodes mentioned, he will be here next month on October 28th to do the second part of this series. And he'll be teaching us more diverse coping skills and give us some practice and help us learn how to integrate those skills into our daily lives. And the Wellness Committee will give you some advance notice about this. And there'll be plenty of table tents, by the way. And I want to thank you all and see you then.